Well, thank you, Steve. And I think I'm going to use my moment of gratitude to thank all of you for staying and still being here at this hour. I recognize that I have the dubious challenge of keeping your attention before the concluding remarks and really before the reception. So I appreciate you being here. But I do think it's important that I'm here talking at this time of the day, because hearing what you heard throughout the day, the stories of the programs that we have, the innovative approaches that are being tried, and the stories that we are hearing from our caregivers, the individuals who are shouldering these challenges every day, are really critically important as we think about the future of military and veteran caregiving, but really in identifying the research priorities that will and the research that can be done to underpin a better support path for the future of military and veteran caregiving. So I'm really thrilled to be here, but I'm going to ask you all to do me a favor. It has been a long day, and if you are able, I want you to stand up and stretch, or I just want you to sit up straight in your chair, because I need you to focus. All right, and you can sit back down when you're ready, but I need you basically to have some blood flowing, your mind's thinking, and be ready to help me as we talk a little bit about a blueprint and how we're going to build a blueprint for research to support the future of military and veteran caregiving. So I think it's kind of apropos, and I'm very, very grateful again to have been asked by the Elizabeth Dole Foundation to come and help them really craft this blueprint. It has been a little over 5 years since Senator Dole and I first met when she came to my office, and she asked me, what research exists? What do we know about military caregivers? She shared her stories, and she did what she has done in all of her public life. She wanted to base her efforts on the latest and best evidence. At that time, we really didn't have much research, and it was really her leadership and her vision and the founding of her foundation that got us at the RAND Corporation started. We have been doing decades of work studying our service members and their families, but we had never really looked specifically at the issues and challenges facing those that are caring for the wounded, ill, and injured. So with her initial grant in 2011, we were able to kick off this research portfolio. That work, which we released in 2012, kind of just scratched the surface. And then she was back again saying it's time for us to take it to the next level. So I do want to reflect on that study because I think it sets the stage for where we're going now. And she hit on some of those themes earlier this morning, so a little bit of this will be repetitive, but I think it's important, again, just to remind us of what we learned that is going to be important for us to build upon for the future. So it was that 2014 study where we were first able to wrap our arms around the size and scope of military caregiving in the United States. Based upon a national survey of households, over 40,000 households we talked to in the United States, we were able to identify that there were 5.5 million caregivers. At that time, this is now an estimate that's 2 years old, we learned a lot about the characteristics and needs, the roles, and the burdens of this population. And in that report, we also kind of forecast a little bit about the future. And so that's why it's very, very important that today's theme has been about the future of caregiving. As you heard this morning in the talks, we identified a number of the gaps in services. Many of them, remarkably, have already been addressed. And so we've seen great progress. We know that at that time, most of the programs that were available were really tending to meet the needs of the veterans, not of the caregivers. Now we've seen new programs that have been developed specifically for caregivers that are anchored and tailored to who they are and what they need. We've seen the expansion of eligibility criteria to take what we are doing in our communities and expand it to meet the needs of those who are even under the age of 65. We've also seen programs adapt who they include to include those that are non-family members, so battle buddies and other friends. But we identified two specific threats to the future of caregiving, and you heard about it today. You heard about it from Senator Dole, you heard about it from Secretary Bob, and you heard about it from the caregivers themselves. And those needs were identified around the challenges associated with aging parents. 25% of the caregivers to the post 9/11 veterans were parents, and we know that in just 15 years, they're going to reach an age where they're no longer able to perform those caregiving responsibilities. We also know that the caregivers to post 9/11 veterans, many of them are in young and fragile marriages. And while they are incredibly resilient, they are facing stress and burdens that would challenge any marriage, and they may be vulnerable to dissolution. So with just those two threats, we know that in 15 years' time, we are in fact going to face a crisis in military and veteran caregiving. But it's not just for military and veteran caregiving. We know that in the United States, as we age, that is the one guarantee with time, that we are facing a huge increase in the proportion of the population that will be over the age of 55 and 60, where we are going to face a caregiving crisis more broadly. So the timing of the National Academy of Medicine's report is really quite critical. The legislation is also very important for really making sure that the future of caregiving is on everybody's mind. But we also talked about the threats in the programs that are available, both in terms of their maturity. Many of them were very new. They were using novel approaches that lacked any evidence of effectiveness. And we know, as we heard again this morning, that many of the programs were being supported by philanthropic support, and there's been concern that that support will be waning. So these cracks in the infrastructure are also things that we need to shore up. Now, we have seen in the past couple of years many more studies that are being done to evaluate the efficacy of specific interventions and to really look at how we can ensure sustainable solutions for the future. So again, in 2 years, we've made progress. But in our path to a better support, some of our recommendations not only outlined how to meet the current needs, but how to really focus on the future. And if you recall, one of those recommendations was invest in research. And that's not just because I work for a research organization, but it is because that data, that evidence, that information provides so much clarity and guidance about how we can move forward together to really ensure that we address the needs of our caregivers in the long term. So, research. What do we mean by that? There are many types of research. We've heard about it today. Do we want to do observational studies? Do we do intervention where we're testing whether or not a specific solution or a treatment is going to work? Are we going to do studies where we examine what happens just naturally over time? Or are we going to test different types of policies or programs? Do we do clinical research? Do we do social sciences research? Do we do research that is focused on economic issues? There are many different ways that we could go. And the problem is that the path that we choose can be unclear. We may want to shoot in 1,000 different directions and let 1,000 roses bloom. And while that may be a great idea, we don't necessarily have the resources or the time. So a roadmap. A roadmap certainly will help us chart a path forward, but it may not be the best quote-unquote term to characterize what I think we really need. And what I think we really need is a blueprint. What do we mean by a blueprint? Well, if we're going to build something very complicated and very structured and intricate and even fortifying, I think we need the plans that can be layered over the top of each other to understand that it takes multiple different professions and disciplines and approaches to think about how we build something and how we build it in a very strong, secure way. Where do we put the steel girders? Where do we build the support beams? Where do we put the plumbing? And which drapes do we want on the windows? So while we're not necessarily building Cinderella's castle, we are trying to build a better future for our military and veteran caregivers. So we need to think about a research blueprint for how we get there. And we need all of you to help us to build that. While I am a researcher and I can certainly look at the landscape of what's been published, I can talk to my colleagues. We heard a lot of great ideas today. I will probably be biased in what I both think is needed but what I find because of what's been published. And so I think we also need to hear from you, as we've heard today, about your priorities and your needs. We all have different perspectives, and those are very, very important. Again, Courtney talked about her perspectives, about the financial issues and burdens. You heard Dr. Malik talk a little bit about the concerns around clinical interventions and emotional well-being. We know that family-centered care is something that is very, very critical. But we also know that other groups have important perspectives, and most notably the caregivers. There are many different types of individuals in this room, and so I think it's important that we hear from their perspectives. Stakeholders, you are all critical stakeholders in this opportunity. So before we kick off what I'm going to invite you all to participate in, I want to just expose you to a few other ideas from different perspectives. And so I've asked a few of my friends somewhere in the audience, I gave them a homework assignment last week to share with you what they think are some of their perspectives around research priorities. And so you heard from the caregivers this morning about what concerns them and what keeps them up at night. You heard from my fellow colleagues in the research community about what they see as gaps and challenges to the future. But there are other groups here that I want to just take a second for us to listen to, because I want your juices to really get flowing, because I'm going to ask you to participate in a couple of different exercises, and I want you to be informed by some of these other perspectives in the room. So I'm going to first ask my colleague Jackie Mafucci from the Iraq-Afghanistan Veterans Association to give her perspective from a support organization that is primarily focused on service members and veterans. So Jackie, what is your thought on burning research priorities to really shore up the future of military and veteran caregiving?
Thanks, Terry. Getting there. Oh, there we go.
There we go.
All right. So yes, Terry gave us a homework assignment, and so I am a researcher myself. I call myself a reformed researcher. So I'm a neuroscientist by training. I headed to DC about almost 10 years ago to get into the policy world, because I really wanted to kind of get at this translational research idea, implementation science, the hot new word, right? And so representing Iraq and Afghanistan veterans, my role at IAVA is really to do exactly that. Hear from our members, get data from them, and turn that data into policy and programs. I don't know that I have a short answer. I know you're like already looking at your
No.
So one, I'm like the poster child for program evaluations. We've talked about this a lot today. If we keep saying, we don't have 15 years to do research. What we do have, we need to look at short-term and long-term, and the short-term is going to be programs. But we don't have a common language by which we can evaluate programs. So I think always when we talk about this, we need to start from the common language. What's that data set that we're going to all understand and use so that we can all be speaking the same language moving forward as we're doing program evaluations? So that's really the short-term. The part of that program evaluation is that social sciences piece. So hearing from everybody in this room, all the caregivers, what's going on in your lives right now? Because that should be informing the programs. And the programs should be getting evaluated with a common language. So that's a really great short-term loop. And then if Terry doesn't boot me, you just tell me, cut me off.
I need a gong.
So long-term wise, honestly, we've heard about a lot of research initiatives that are happening right now. There are also some really great examples of databases that have already been put into place. The Joint Suicide Data Repository is a collective that's been established with DoD, with the Center for Disease Control and VA. This is a win. This is a database that all of the federal agencies are pulled into and have joined their data so we can understand more about health outcomes for veterans. So what federal databases exist already where we can use that model, or maybe we can even use the Suicide Data Repository. It's not just about suicide. There's a lot of health data in there. There's the Millennium Cohort Study. There's a Vietnam Veteran Study. There's a lot out there that's going on already. So how can we leverage what's already existing to learn more about what needs to happen? And then I'll do one more thing, I'm going to shut up. The other piece of this is, I see now I just lost my thought there. Community needs assessments, right? So we look at this on the federal level, we have to go into the communities as well. So there's some great initiatives happening right now in the communities. These veteran collaboratives that are popping up where you have service providers that are meeting around the table, meeting with VA, meeting on the ground to talk to one another. And really connect people to resources. And they're also investing in gaps assessments within their communities. So understanding what the communities have and what the communities need. This is a great initiative for local governments to get involved in, for state governments to get involved in, because really all of these initiatives are going to happen at the grassroots level. That's where the networks are. So that's another piece that I would add is like we really need to invigorate on the local level in the communities these types of evaluations to make sure that this isn't just happening at the federal level, but is happening where everybody is.
Great, thanks, Jackie. So we heard a little bit about the importance and the need for program evaluation, the opportunity and the use of existing data sets that have been collected for other purposes, and the need to identify gaps in communities, both in terms of the needs on the ground, but the gaps in the services available. So I want to keep kind of in the perspective in the sector of support organizations, those organizations that are also kind of designed to really advocate on a community's behalf for changes in policies, improvements, and programs. So I'm going to ask Joyce Razor from the National Military Family Association to talk a little bit about what she thinks are some research priorities directly related to how we build this blueprint for veteran caregivers. So Joyce.
Thanks, Terry. And I think I already gave the hint about what I was going to talk about earlier, and that's the kids. When our military went into war, we didn't know a lot about kids in deployment. When our military members got injured, we didn't know a lot about military kids and an injured parent, much less how those children are responding as caregivers in their homes. One story, National Military Family Association runs camps for kids of the deployed and camps for the injured called Operation Purple. And one of the things that our civilian camp directors continue to tell us is our Operation Purple military kids display homesickness in a different way than their civilian peers. Civilian peers are homesick because they miss their comfortable bed, they miss their air-conditioned house, they miss their video games, they miss their TV. Our military kids are homesick because they're worried about what's going on at home and is everybody okay when they're not there. So how do we learn more about our kids? What are the factors? Does the age of the child when the injury occurred make a difference? Does the injury itself of the service member make a difference? What are the dynamics in a single parent home versus both parents there? What are these children's healthcare usage, educational issues? As we look to the future, what kind of higher education options are going to be open to these kids, both financially and because of the connection at home? What kind of employment? How are parents adding in the caregiving responsibilities in terms of parenting? What kind of caregiving duties are children assuming? They may not be doing the meds for the injured service member, but maybe the 10-year-old may be watching the 3-year-old. So how do we learn more about these children to continue to help the children, but also to think about the future? What do we need to know for the family of the Marine who's injured in a helicopter accident in 5 years? How can we make things better for future families while also thinking about how do we help the folks in this room and the folks like them at home? So an emphasis on children, what's going on, how are they interacting with the caregiving? And the other piece I'd like to emphasize is that when we talk about children, let's not just limit the discussion to the children of the injured service member or veteran. Many of our, as our wonderful mom on the panel this morning talked about, she had a son in his 20s who was injured. We know of injured service members who were injured when they were 18, 19, 20, who had a middle school sibling, a high school sibling at home. What is the effect of this experience on them, and how can we use that information to build in a better support network for these kids? So
Great. So an emphasis on a particular population and the impacts that caregiving in their home may have on their outcomes. And I know that this is a theme that we heard earlier from some of the caregivers that Jessica and I have talked about a lot, and I think I saw it mentioned a bunch on the board outside. So the focus on a particular population and the impact of caregiving, so for children. So now I want to turn to some folks who are responsible for implementing some novel and innovative programs and kind of thinking about best practices. So my colleague and friend Lisa Esom from the Rosalind Carter Institute for Caregiving and Operation Family Caregiver, what would you say are some research priorities?
Well, I would agree with my colleagues that have already spoken before me about the importance of implementation science. That's critical as we move forward. And it's been highlighted today how important it is that we measure program impact on the caregiver. Caregivers have shared with us through Operation Family Caregiver anecdotally that while they have been helped, their spouse and their children have looked at them and said, you know, you're starting to care for yourself. And they're starting to take on some of these roles themselves. And so we're seeing, but this is all anecdotally. I think that we need to measure that aspect of program, I guess you call it carryover, transfer effect on these children, on the spouses, the veteran, the service member. I think that's very important. If proven programs that are already in place, maybe if they work for the entire family, we mentioned economics earlier. That might be economically sound to move forward with something like that. But I think we also have to be open to the opportunity to ask the question, are there other aspects of the program that could be enhanced to affect these family members? Thank you.
Great. Thank you, Lisa. And now to another individual who has the responsibility for overseeing programs to support military caregivers, Meg Cabot from the Department of Veterans Affairs.
Thank you. So we've also heard sort of anecdotally about the physical impact of being a caregiver, and we hear this in our in our partnership with Easter Seals. We have folks go out and do training, and there will be a room full of 30-year-old individuals, and 4 or 5 of them will report that they've had to go to the ER urgently because of high blood pressure. We've heard that for a couple different times, and different versions of that story, different ailments that should not be impacting people at that age. So I think one of the things I think we really need to look at is the quantifiable impact to an individual's health as they are a caregiver. And this is not easy because, for example, in VA, and we've done great work, Courtney talked about, we can look at the impact of caregiver support on the health care of the veteran. And we know that supporting caregivers gets those veterans into treatment that they might not have gone into previously. So that's great. We can look at other health areas and aspects of that individual veteran. What we can't do, because most of the caregivers that we're working with are not getting their health care through VA, is look at the impact on their health in a quantifiable way. And I have thousands of ideas about how to do this. I mean, we have worked with more than 30,000 caregivers. And so, in really creative ways of looking at potentially partnerships across other federal agencies, take a look at Medicare data. Many of our caregivers have access to Medicare, partnering with DOD and looking at TRICARE data. I think there are ways to do this, but it's going to take some funding and some innovation. So, but I do feel strongly that's an area that we really need to look at, because if we can quantify that, not only part of it is, and I do say this a lot when I talk to groups who are not ready on my side of caregiver support, so it's a different spiel than what I have to say to this group, but this isn't, caregiver support isn't just something we're going to do because it feels good and we want people to feel better. It's much more complicated than that, and it has much more of an impact than that. And so if we can quantify the impact that's happening physically to our caregivers, and we know the ultimate, the cost that is causing to our healthcare system. So now we have the veteran cost and the caregiver cost. We're going to get a lot more power behind what we need when we ask for big things from Congress and other agencies and all of our partners.
Great. Well, thank you. And so the last person that I asked to do a little bit of homework before we came is actually someone who has the opportunity to look at proposals and actually make some funding decisions to see the type of work that gets done. So Catherine Grimes from Bristol Myers Squibb Foundation.
Thank you, Terry. Yes, so as a funder, we are funding health outcomes research focused pilot and demonstration projects that develop, implement, and evaluate models of community-based care and support. So when Terry asked me to think about what I thought were the research needs, and when you look at that very confusing research roadmap, I always think of interventions. So I'm thinking, what are some needs for interventions for caregivers? And Senator Dole definitely teed up the severity and the real, call to action now of the issues that these caregivers are facing, everything from depression to suicide ideations, to intimate partner violence, to even the financial issues we heard from the last panel. And, when I think about what do we need to do to start to fill some of these gaps in support, I think we need to first and foremost, I want to advocate for an approach to research, which is that of community-based participatory research, which involves, it'll help us to avoid some of these pitfalls that we've heard about all day long, where the researchers are sitting in silos in their offices and crunching the data or coming up with that academic question, but then they can't get the participants to enroll in their studies. They can't engage with them. How do you get the participants to come? Or we can't just ask the caregivers, because we saw from that panel, they're in the throes of it. They may not even know what they need. They don't have time to think about themselves. So really from the very beginning, as we're starting to scope and scale a lot of these interventions, taking a community-based participatory research approach, which equitably includes all stakeholders from the very beginning, from the design, from the white papering, the design, all the way to the development of the intervention, and then finally to the testing. And I guarantee you'll have a lot easier time getting subjects recruited into your studies as well. So really, I'm just thinking more of an approach and trying to break down some silos from the very beginning.
Great. Well, thank you. So as you heard, different perspectives, many of them, and they all can offer different ideas. All of you also have different ideas. And so we can't pass the microphone around and hear from everybody, but we do want your input. We want to hear your ideas. We started asking you those this morning as you came in. We asked you to jot down some thoughts about research questions and research priorities and put them on the board. And we are going to collect those and we are going to take a look at them. We all have different styles in the way that we wish to express and share our ideas. Some of you are more confident than others in coming up and sharing with researchers what you think are the priorities. And like Joan, I like to have people think about, well, what's the question and what do you think is the solution? And then we can actually design what is the most appropriate kind of population, the best design, and the most appropriate kind of methods that we would use. So I need to hear from all of you about your ideas. Thank you to those who put their ideas on the bulletin board, but you're not done. In fact, I need you to stay engaged. On your tables, you will find in the center a survey. Yes, an old-fashioned paper and pencil survey. And I need you all to take a couple of minutes with a pencil or a pen, just like those standardized tests that you may have taken when you were in school. I need you to take a couple of minutes and actually fill these out. And I need you to do them today before you leave. And yes, this is voluntary, so I am not going to force you to fill them out, but I really, really, really want you to. And this input will be really critically important for the next couple of steps. So we're going to pause for a couple of minutes. I want you to take in what you've heard all day, and think about what your own priorities are from your perspective. What do you think are some of the ideas? And you'll see, you can certainly start filling it out while I am talking. On this survey, there are a couple of different sections. We really want to know what you think about the different populations of caregivers. Are there some that have been understudied? Are there some that we really, really do need to think about prioritizing? We heard from the caregiver panel that we need more information about male caregivers. The study that we funded, or that we conducted for Elizabeth Dole earlier, a couple years ago, actually identified that 40% of caregivers are men. And so we need to think about our male caregivers. We also heard already about kids. We also have a section about consequences. Now let's recall that consequences can be both positive and negative. So what should we be looking at? What are the types of impacts that you think are really, really important that we should be studying? So take a look at the ones that we've listed, rate how important you think they are. If there are some that are missing, please write those down as well. On the survey, you're also going to find a section where we ask you to tell us if there are particular types of caregiving, that is, care recipients with particular types of conditions that we need to study a little bit further, that really should be considered for this prioritization and process and put in our blueprint. Is it really around mental health conditions and these invisible wounds? Are we talking about more of the physical injuries and disabilities as well? And so take a look at those conditions that we've listed and tell us how important you think they are. Again, if there is something missing, please fill it into the blank. We talked a little bit about program evaluation and testing different policies and interventions. And so to the extent that you think that there are different aspects of program evaluation and intervention research that are important, you can take a look at that in Section 4. In Section 5 of the survey, I am going to ask you to actually make some choices about what you think is more important. So it's a simple rank order exercise that if you had to choose how you would rank those entries 1 to 7, I do want you to go ahead and do that. And then finally, there's a section on the survey where you can fill in some of your other comments and ideas as well. So I'm going to pause for just a couple of minutes and let you fill out those surveys. I do have my colleagues here in the audience who are actually going to help me collect those surveys, but I'm going to give you until the end of my presentation to complete them. But this is really, really a critical step in gathering some stakeholder input for how we think about this blueprint. Still see some people working. And then maybe I could ask you at your table if you could just collate them into a pile, and if one person at your table has the pile, then we can make sure that we get that picked up. I can tell some of you are very fast test takers. That would be my son, just A, write everything down. So is everybody pretty much done with the survey? No, okay, I'm not trying to rush. I do, I really want you to get a great grade on this. So if possible, can I just get a quick show of hands of how many people are completed? Great. I'm going to wait 1 more minute before I talk over. All right, well, great. Thank you very much for taking the couple of minutes to fill those out. We are going to be using this information to kind of help us gain a perspective in a sense of what you all think as really, really key stakeholders in charting the future of military and veteran caregiving. Think about research priorities and research needs. But again, this is not the end. There's another section. We want to facilitate an exercise where we gather and create consensus among the stakeholder community. And so while what you did is a first important step, we want to invite all of you to participate in an online expert panel. You are all experts. You have experience, you have relevant exposure to the issues that caregivers face. You may be implementing policies or programs that are important for supporting them. So we want to invite you to be part of what is an online expert panel. To do that, we ask that you actually go to the URL that you can find on the screen. There are also business cards on every table that include this URL. If you want to do it now, you are more than welcome to visit this particular URL. You're just going to be asked a few questions and to submit your email address. Once you submit your email address, you'll then be invited to participate in a 3-stage online expert panel process where we're going to present you with a series of questions and ask you to rate the importance, the relevance, and the feasibility of pursuing different types of research questions, and then ask you to submit those within about a week's time. Once it starts, it'll start probably in about 2 weeks from now. You'll be given a week to submit your input, and then we'll invite you back to the expert panel so that you can see what your colleagues said. You'll be able to see the responses that were generated from across the entire group and the expert panel, and then asked to provide comments and have a discussion. You may be influenced by what you hear and what you see from some of the other participants, so you'll be asked to then also evaluate whether or not you would change any of your ratings. This is a validated approach for running what is ultimately a very efficient expert panel process with about 350 people. So we hope that you will log into that URL and that you will take a couple of minutes each time you receive an email from us to go online and fill out your evaluation of the priorities, as well as provide us with other feedback. If you have other suggestions or ways that you want to suggest research priorities after today, you can certainly also email us at care-panel@rand.org. So we will take your ideas, we will take your suggestions, however you want to get them to us, but please get them to us, because building that castle is going to take all of us. And ultimately, we want to be able to generate a blueprint that is going to lead the research strategy into the future so that we can better support military and veteran caregivers. So with that, I'm going to turn it back over to Steve and to Matt, but I really do thank you for your time, and we'll be coming around to collect those surveys, and please take the business card so you can remember to log into the panel. Thank you very much.